call the City of Franklin Board of Health meeting to order June 13th, 2022. At this time, we are missing Pat and Peggy, and Dr. Golden said she'd be late, and Lori said she will not be able to make the meeting. So at this time, we need the approval of the minutes. From the April 11th meeting.
Move to approve.
I'll second that.
Okay, any discussion? Hearing none, all in favor of approval of the minutes of April 11th, say aye.
Aye.
We have no citizens. Is there any unfinished business?
There is not.
Okay, then we're going to move right into new business and the administrative report and announcements.
Perfect. I will first touch on exciting additions that we have to our staff in terms of volunteers and interns for the summer of 2022. So this area, Health Education Centers, and it is our first year with the program, so it is at zero cost to us, and the intern themselves gets paid through the program. So we'll have a 40-hour-a-week intern,
Wow.
and he will be completing his internship from June until mid-August. So John started with us last week,
Wonderful.
and Ellen is his on-site coordinator for that. And his focus is a lot around parks programming, increased physical activity, how health department can intertwine our work throughout different facets of the city of Franklin. We also have a Western Governors University student doing a 140-hour internship with us. So that will be most likely spread over 1 to 2 weeks, but she is getting her bachelor's degree in health information management and needs to be supervised by someone or a different tier than our typical staff. So I'll be supervising her on staff for that. And she most likely will be working with our community health assessment project. So all of the data collection that we've been doing, and then those focus groups and key informant interviews, she'll be for that was signed and approved by Common Council at the last council meeting. So we'll be moving forward with signing that. And then we have a university student from Boston who is a Franklin High School student graduate, and she is looking to enhance her knowledge in public health. So she'll be doing about 20 hours average. A week. She does 2 longer days, and then she'll be working on the weekends with the Franklin Parks concert series and the education that the health department puts out there. So we have a volunteer. Yes.
Oh.
So she's volunteering out of self-interest. So she's not a. Her name is Natasha, and she started at the beginning of. Well, actually, now she started last month officially. So she also attended the first reboot to the senior health lunch the senior lunch program at Root River, and did some data collection for us there. So a lot of wheels spinning in the health department right now. But that is in terms of our interns. And then I also wanted to give an update on our internal staffing. So with taking the health officer position, my public health manager role, which was formerly a public health specialist role, is vacant right now. So looking to fill that as soon as possible since we're short-staffed and need all hands on deck. Looking at how exactly that will take place, but most likely aiming to go to council and or the personnel committee if there's any updates needed to any job descriptions during this last June meeting. So hopefully we'll get that on the docket very soon.
Do we still have any trackers?
Do we have any what?
Trackers for COVID?
We do. We still have the 2 that we had at the last meeting as well. So we have 2 contact tracers that are active, and they work 40-hour weeks.
Okay.
That is all I have in regards to announcements.
Any questions under announcements or any administrative report?
So I actually in 2007 was an AHEP intern,
Oh, yeah.
and it was such a fantastic experience.
Where?
And it was, I think it's 8 weeks, when I did it was 8 weeks but 40 hours,
Oh.
and learned and did the array of everything, and it was awesome. So
Wow.
I think it's awesome that you're taking someone on and to be another asset, because I know they were always looking for people.
Yeah, we're excited to do it. We almost did it in 2020. And we had our person assigned, and they almost walked in the door, and then the program had our person assigned, and they almost walked in the door, and then the program got canceled for
'Cause of
COVID reasons.
Okay.
Yeah. And now the program's back, so here's our first year, and we're really excited. He's very motivated, and it will be a nice opportunity.
Is there any net budget effect for any of these?
If you want to have an AHEC intern moving forward, they do ask that you pay to assist, help stipend the student and pay for the program, but that is not applicable to the first year. And we don't need to commit to more than 1 year. We can see how the experience goes and then determine if we found it valuable.
Great. Okay, we're gonna move then to Health Department general updates and the City of Franklin COVID update.
Our most recent COVID-19 update I had included in your packet. This was sent to all common council members and school officials every Friday. We send it, but in this last report for June 1st through 7th, countywide data shows nearly all COVID-19 indications increasing over the past week, so there's been a slight uptick. Overall, recent data supports evidence of a plateau since mid-May and fairly consistent high daily cases. So the last reporting period, 2 Fridays ago, we had 107 cases in Franklin compared to 101, so a slight raise. Kids cases in Franklin, we had 29 cases this June 1st through 7th period, and then 19 cases the week before. But this is no surprise. We've seen it. It's still within the capacity of follow-up for our contact tracers and staff, so we're still calling everyone who is indicated as needing a follow-up call and hoping to continue to move forward as is, so we'll keep tracking that. Your packets will just outline as is, so we'll keep tracking that. Your packets will just outline the general information as well, and then the graph that you'll see, just trend data over time since February, and then since March of 21. And then on the last page of the data packet, you'll find information on vaccine status. We have not been offering very low demand by our residents to come to a local health department. There's a lot of different locations that they can get it within Franklin, and we promote those.
Are we doing anything to promote more vaccinations in any way?
We are through informing individuals of what channels they can go to get vaccines. School district, answering questions when people call, mostly in a connection capacity, connecting people with different resources. So that is all I have for the COVID update.
And what about other communicable disease
Can I
referrals?
just ask?
Oh, absolutely, please.
The trackers then, would they be promoting vaccinations for the families and stuff of individuals that do come down with it and tracers? How does that?
We offer education when we do call people
Okay.
about a positive COVID-19 case. So sometimes they are vaccinated, and then we talk them through that. Talk about different mitigation measures to keep your chance of getting COVID-19 as low as possible, and that is shared.
Now, what is also the update on under age 5?
That should be coming at the end of June, so keeping a very close eye on it. That, again, we won't be offering due to people going to pharmacies or primaries and things like that.
Okay. Okay, any other questions? If not, we'll go to other communicable diseases.
We have had no major updates in communicable disease. No major updates in communicable disease. Just one interesting thing is that we've had an uptick in lead follow-up, but that is mostly due to the lead measurement of follow-up being slightly changed. So we used to follow up on reporting of 10 micrograms of 5. So we're just getting more reports based on that. We've done a recent home visit. You take a sample of different things. You do a robust interview with the family. Send the samples off to the state lab. So our staff is working on that one. But other than that, nothing major to report.
When did they make the change from 5 to 10?
You know, it was it was over a year ago, but still recent. So we've seen that come in steadily, and I don't believe that we've reported that out to the Board of Health. Note of it, that it is something that we've been seeing.
Nothing else in the communicable diseases like pertussis or
No,
influenza? No,
nothing major to report that we're seeing.
that's good. Okay, any other questions on communicable diseases? If not, we'll go to human service referrals.
We recently had a human health hazard declared for a home in District 2, which was right over here on Kensington, Alderwoman Eichmann's district. So what that entails is when usually a referral from PD or fire who goes in and gives us information that it may not be a safe living condition, and then we do an investigation as the health department and have conversations with the owner, the family. But that has since been remedied, and now the order has been, so it is back on track. The homeowner is doing well from family reports, and
What happened with the other hoarder?
that situation was resolved earlier this year.
Did they sell the house?
The home was sold,
It
and
was.
then the new owner takes on the order. The home was sold,
It
and
was.
then the new owner takes on the order, and then that was cleared based on their mitigation efforts of
Okay.
the hoarding.
And it's being remodeled. My husband and I just walked by because
Oh,
we're
really?
curious of the updates.
Okay.
Yeah, so they're completely doing an overhaul.
Wow.
It's starting to look good.
Sound like they had to.
Yeah,
Dog bites?
Dog bites have been on the rise, but that is a trend in the summer. So a lot of, well, I guess not a lot, but more than typical are coming in. Follow-up referrals come from PD usually, or emergency rooms. Report from a hospital to say that someone has come in to be treated for the dog bite, or PD responds with a citation, and we follow up. But we have had quite a few over the past few weeks, and just working through those case by case.
Any instances where you've required them to put up a fence?
Dangerous dog had a vicious dog declaration. We had one instance that was teetering on a dangerous dog declaration, but that really depends on provoked or unprovoked, and that also depends on public or private property. So if the bite is happening on private property, you have to look at the different factors in that. So we have not had anything that had to have response in that way, but
There was
case by
one-
case.
There was one over on Harvard a couple of years ago. Is that still active, or is it been taken care of?
I would have to look into that. I don't know off the top of my head.
Another one in my district, that's how.
Okay.
I
Sure.
think they're required to put up a fence.
Okay.
So if that happens, then it's been resolved, I would imagine.
Yeah, the declaration still stays, and PD has that on file. We have that on file. Well, instances, it would be a vicious dog declaration, and then more drastic steps would need to be taken to protect the health of the public. But you're right that the first steps are then typically put up a fence, keep your dog on X number of feet of a leash, a muzzle, and try to do any measures possible to keep everyone safe, but then still have the dog living here in the city, and then you need to move on to more drastic measures if other instances occur. That is all of those.
Says we're gonna move right to community health programming. And the new Franklin Senior Lunch Program is up and running.
Yes. I'll talk a little bit about it, and then if you want to add anything in, Alderman Barber, but I'm not sure that we reported on the Franklin Senior Lunch Program last time we met, because that would have been in April.
Right.
And since that time, what we've done is had, during more of a lull in our COVID-19 contact tracing, we were able to utilize our contact tracers to call the 2020 members of the Senior Lunch Program here. And that's a program that used to meet at Root River every month, and get together for a lunch and speakers and entertainment. And we were gauging interest because we had heard in the community that people were interested in a resurgence of the group. And there was a robust interest, and we moved forward with asking who may want to be leaders of that. And we had probably about 25 individuals from Franklin that came to those first few leadership meetings to get it going again, determine the roles that would be necessary to make the program a success. And they had a few meetings, and we had our first lunch in June. So
Was
the
there a
first
speaker?
June. So
Was
the
there a
first
speaker?
we were the speakers
Okay.
in a way. So Mayor Olson was there.
Okay.
We talked about, a member was there to speak about the transition, about where we once were and where we are now. Health department was there, just aid as necessary, no major speaking parts. And they'll be now has had a debrief meeting after that first lunch, and it's pretty much in the member hands now. So health is really playing more of a hands-off role and just helping troubleshoot any questions or things that might come up that they need.
How many attendees?
We had 74 come up that they need.
How many attendees?
We had 74
Oh,
attendees.
wow.
Yep. So they had an RSVP of about 85 and 74 came.
How do they advertise that?
Well, word of
Website.
mouth.
Just word of
Yes.
mouth?
It was going in the website and city newsletter, but the city newsletter did not go out.
I think there'll be probably upwards to 80 to 90 when this thing settles out. One of my, two of my constituents that I was real close to, Casper Green and Fred Knipple, had passed, and they were the leadership, so it kind of fell into,
A gray area.
yeah, a period of nothing.
Yeah.
And right now, with the efforts of Lauren and the mayor and putting it all together and holding the meetings, it's taken off. I think right now they're in the process of finding all the old records to see if there's, as a final business form, and working with that to finalize the structure, because there is a slate of officers. And I plan on continuing with it because both Fred and Casper asked me to.
Okay.
And so it was kind of like their wish
Yeah.
that someone from the city stay with it. So I'm a member of it as well. So I'm going to be staying with it, kind of list, not as an official capacity, but kind of to be involved. So
How is it funded?
mostly by themselves right now. They had quite a bit of funding at one point to buy a community center,
Okay.
and the
Okay.
community center aspect never came into being. And with the prices of doing anything now, they decided that Casper and Fred didn't know what to do with it, so they kind of took the funds down by donating to like the K-9 Pro, special needs that they could take money out and fund specifically. So the funds are there. Right now, I think there was like $10,000 left, or $10,000 in the budget for seed money to get it started, so.
Do they
that's-
collect dues?
Hmm?
Do they collect?
Yes, they do, and
Okay.
it's supposed to pay for itself with people buying their own lunch.
They collect-
Yes, they do, and
Okay.
it's supposed to pay for itself with people buying their own lunches.
I got it.
And there's also there's also a senior walking group and a senior pickleball group that are all kind of the same mesh.
Branches of this?
They're the same mesh of people. So it's a big swirl. Each one wants to keep its identity of what's going to be there for all the seniors,
Oh,
and
that's
they kind
great.
of come together as a group.
And in the past, there's been dedicated funds for senior programming in the general budget. So some of those funds help cover half the lunch cost for each senior. So it's $5 per senior, and then the city of Franklin, the $4.50 to help pay for it.
And will that continue?
The budget is determined every year, and that's a mayoral and council
It's
decision,
coming
but
up. I haven't seen this year's version yet, but I'm assuming it would probably be there in some form.
Okay.
and then there's also the fund that Alderman Barber discussed that they few
Yeah.
meals.
Okay. There are no more questions on senior lunch program, then we'll go to maternal health, child health assessment.
Did you have something to add?
Oh,
Okay, we are.
September 14th.
Okay.
Oh, the assessment.
Yes. So we're really
We're
excited.
gonna do an assessment tonight?
Yeah.
Yeah.
We have so many. But yeah, so we're due September 14th. and
Okay.
It's our first. It's a boy.
My daughter just found out she's expecting, so
Oh, do
November.
Yes.
Oh, all right.
Yeah.
I love it.
my
Yeah.
first grandchild.
Yeah.
My first grandchild.
That's so great.
Oh, that's exciting. So this will be the second. Well, my sister's in labor right now.
Oh my gosh.
So I'm just, if you
Oh
see
my.
me check my phone,
Oh my goodness.
they don't know the gender. They're not like me. I can't wait.
My,
So
yeah,
they're more patient.
my daughter, yeah, it's a girl. So.
Yeah, so we already
Yeah,
knew
yeah.
at 12 because she'll have 2. So my parents will have their hands full this summer.
Wow.
Or this fall.
Wow, well,
I
that's
know.
exciting all around. Awesome. Well, in the health department, we are looking to continue our services for parents and children in the Franklin community. With COVID, a lot of direct services had to kind of decrease in order to respond. Services had to kind of decrease in order to respond to the pandemic, and we're happy to be leveling that back out. So we have sent as a department a survey out to individuals who have recently had children that live in the city of Franklin to gauge interest on different programs. So those who had, I think it was under 3 years old, kids that are still in infancy. And sad to say that we haven't had a great response. So the postcard included a link to a survey, and it had a QR code to make it what we thought was easy, and hopefully we'll have more responses roll in. But we had about 30 people roll in, but we had about 30 people answer. So
And how many went out?
multiple hundred.
Okay.
I have 300 to 500. I can't remember exactly, but yeah, we'll see. Hopefully we can reach parents in all a variety of ways, but we thought that would be the most effective way to reach parents at their houses to make it easy for them.
And these are parents that have kids at what age?
3 and under.
Okay.
So different services that we offer, like car seat inspections or checks and lactation counseling, different things like that, and trying to figure out where we're gearing our programs as we have our community health assessment currently happening. We were recently at the Ascension Family Night, so Alan and Quinn took the survey there. But we'll be able to reach them eventually, and hopefully in some kind of capacity, but it's a start. That's where we are with maternal child health.
Okay. Anything else on maternal child health? If not, we'll go to community health.
Well, with our community health assessment, this is the month of our community health assessment partnership meeting, which is very great. I believe, Henry, you have received an
I just had surgery, so.
Oh, okay. And Alderman Barber, I believe you may have received one as well, but I'll follow up with you guys offline.
I'm a goal, so.
Okay, that sounds great. So we sent out a selective but yet large invite list to try to get individuals from all across the Franklin community to represent different partners and sectors in our city. And the goal of that is to have a voice from all different types of people about what we should focus on as health priorities here in Franklin. So at this have the data presented that we got from our focus groups, our key informant interviews, the hundreds of surveys that we received back, and really just taking a robust look of what we're seeing here in Franklin, and then what the people in the room feel like is the need based on what they're seeing and what the data's showing, and really making that informed response for our key initiatives that we want to focus on as the health department. So the goal is to walk out of there with an idea of what the community as a collective whole would like to work on, and then from there we'll break it down further into work groups and different initiatives and who wants to do what and how everyone wants to help. But this is really more of an informational conversation happening next week. So that will be happening on Tuesday. We'll have an external facilitator.
Next week, Tuesday.
Yes.
Okay.
What time?
What?
It is from 9 to noon.
Ooh.
But it is going out to specific individuals, but we do open it and say, oh, as a representative of Board of Health, if you can't come, let us know if there's someone that would be appropriate to invite in your place. We did also invite Lori O'Neill, but I did warn her that we might reach quorum if you and then Alderman Barber were there. So if one of you can't make it, we can also,
Yeah, I probably
Touch
can,
base
because I've
with-
been off work for a while.
okay, we can touch base with Lori then
Sure.
as well. But that will be happening, and we'll get back the results to you guys at the next meeting.
Okay, okay. So after that, spring sprint.
The spring sprint is the adaptation of the typical annual 5K that we host over by the high school in May usually with Fit Franklin. This year it was a 2-mile walk run. It happened back here in Lion Legends Park. Cool. So that was great. Amy volunteered as one of our helpers at the registration check-in table. But it was really good. It was nice to have an opportunity for community members to come together. We did send out a follow-up survey or put one out there. Haven't really had any response, which is hard. So looking to see. We don't want to host the event if people don't want it, but 100 people is great, and hopefully we continue to move forward with that. We had different partners in the event, including DPW, who helped with the road closures and all the signage. Volition, like I mentioned. They had volunteers come, and then Ellen helped coordinate a lot of things for the Volition Franklin Coalition. The YMCA ran the Toddler Dash, so that was a new event for us, geared towards little kiddos, and they just did that in the grassy area to have kids run a 20-meter dash, very short distance, I can't remember exactly. Franklin's Lion Club and Franklin Lioness helped and donated their time and efforts, and then Franklin Historic Society made an appearance, so it was good.
And the auxiliary police
Oh.
were along the course.
Mhm.
And they were really, really helpful.
Yes.
Was weather a factor at all?
It was nice.
I mean,
So-
leading up to it, that might be, people didn't want to
Yeah.
come in because of the weather.
Yeah, but
that
they
was-
could register up to 2 days before.
Oh.
So from that perspective, it was hopefully accommodating to people. I don't know. It's hard to tell. We thought maybe before, as Fit Franklin, the planning group for this was speculating, is it because of time of year? Is it because the 5K is too long? I don't know. But
We
maybe.
used to have that in the past in Whitnall Park, and we did it in conjunction with Greendale.
Sure. Okay.
Yeah.
Well, we'll see. Many months to now think about our next one, so hopefully there'll be some great plans laid out.
Okay, and the tobacco poster contest.
For that, I will throw it over to Ellen with Volition Franklin.
Yes, so I wanted to present our winners of our 26th tobacco poster contest. So this has been going on in the community since 1996. Contests are taken, I believe, directly from the tobacco licensing fees in the city. So every year we go and present to our 7th graders. This is one of our largest 7th grade classes yet, so almost 400 students in the 7th grade class. Happy to say we had over 270 submissions for the contest. And the first 2 pages are your top 10 winners. Each of those winners receives a $100 gift card, as well as a copy of their poster. And they'll also be honored at the last meeting this coming month. There were so many great submissions that we added an extra 5 honorable mention winners at the end as well too.
Are these displayed anywhere?
We are going to order 2 copies of the posters, so we're looking into where we might want to display them.
Because they used to do it,
Yep.
and then, well, we had a billboard for a while.
Yeah, it used to be a billboard contest, but then that got a little pricey with
Right.
the number of winners. And then we also did display them at the movie theater, which the past couple years we hadn't been doing because of COVID, because
Okay.
there was kind of some inconsistencies with when they'd be open. So last year we actually took all of these posters and scanned them into the computer and made them targeted Instagram advertisements. So when you upload them onto our Volition Youth Instagram page, age with that advertisement, so you can say ages 13 to 17 in this certain mile radius around Franklin. So then that means it'll show up in those students' feeds on social media.
Okay,
So it gives a little bit more awareness that way and goes directly to the population.
okay.
So it gives a little bit more awareness that way and goes directly to the population we're hoping to reach
Okay.
with these posters. But overall, it was a great year. It was hard to pick our winners. We had about 20 community judges from Board of Health, our Common Council. They all helped vote on our winners.
Great. Any questions, fellas? Anything else?
I know, that's about it, but it's always a fun contest,
Yeah.
so.
It's kind of like great awareness for, seventh graders, what this is saying.
Oh, yeah.
I mean, that awareness is there, and the way they can articulate it, I think is really special.
So much
Yeah,
participation.
over 270 this year,
Wow.
which was amazing. Very motivating for the kids.
And finally, go ahead.
Sorry, there was one other thing I forgot
Yes.
to mention. Each year we partner with Cousin Subs, and they actually offer a free sub coupon for any student that participates.
Oh,
So that's also a great incentive, and that's of the local Cousin Subs to be able to offer that. So.
Great. Okay, and then we'll go right to bike rodeo, which I wanted to be at, but I
Yes.
couldn't.
It happened last Saturday, the first Saturday in June, and I took down a few notes on it. So we had 92 kids
Wow.
come. We had space for about 115.
Okay.
So if you didn't show up, then we had a few slots open at the end. But we also had 46 volunteers. And then for those of you who might not know, the bike rodeo event itself is when bike safety basics. So not how to ride a bike. So we require individuals to not use training wheels because we want it to be an age that can understand the concepts being taught to them, but then ride through the obstacle course with assistance from the local police department and different skills like stopping and looking at and sewer grate, what to do at a yellow light and things like that. So there was an evaluation done on that, and then the results are being tallied right now. So hopefully we'll have more to report on any changes that were informed for next year. But overall, there was positive response at the
Do they
event.
check like helmets and things?
We do a positive response at the
Do they
event.
check like helmets and things?
We do a helmet fitting and offer helmets to participants
Okay.
as well.
Oh,
Oh, and a bike tune-up as well.
who
So
offers helmets?
we do at the health department.
Oh, really?
Mhm.
Okay.
Yep. And then we had a great organization come on board this year that helped do so they assisted in ensuring that everything was good to go and road ready for the kids.
Wow.
What organization was that?
Yes, let me pull it. Gosh, it's a
It's-
biking club and I can't remember the
I
name.
think it's the Southeastern Mountain Biking Group. That's not the exact name, but it's a youth mountain biking group.
Oh,
cool.
Okay,
In
so something
southeastern
along
Wisconsin.
those lines.
Yeah.
Okay.
So there were youth there helping
Mhm.
tune up the bikes, which was
Wow.
really cool.
Oh, neat.
Yeah.
And really a nice example for the children who were going through because they thought it was really neat and they all worked together. So it's fabulous.
Okay. There's nothing else in our community health or health department general updates. We're going to go into environmental health updates.
Before we do that, I found
Oh,
my
yeah.
note on it, and it is Southeastern Lake Scholastic Mountain Biking Club.
Okay.
Just for the record. We were striving to find mechanics, and one of our Volition Franklin members happens to be a part of this
Oh, okay.
organization
Yeah,
and
okay.
reached out to the group.
Wow.
So it was the perfect collaborative
Right.
effort.
Oh, it was Drinka, who's
Oh,
the
Drinka.
supervisor at Ascension ER.
Okay, then we'll move into environmental health.
We have quite a few things happening on the environmental health front. So I think a lot of these go back and forth but most fall under number one about debt cap and the inspections that we're working on. So our sanitarians currently are working on plan reviews for a lot that's happening over at The Rock, and they have some new businesses going in. So the restaurant Bricks, Doghouse, some lodging, Rock and Pickle. So needing to do inspections and plan review on all of those things every year on concession stands and food trucks. So that with just the way the seasons lie, it's a very busy time. So doing food truck inspections for different food truck events throughout Franklin. Croatia Park just had their Highland Games. Some businesses have food trucks come to their locations. The Rock does a food truck night on Thursdays. So our sanitarians have been very busy in that regard. And then inspections for stadium concessions in Little League at The Rock and Lux Bay, because that's developing right now.
What is Franklin's, or how do they handle, I see when I drive on Loomis Road, right around Layton and Loomis, there's a food truck there. Are there food trucks that just come without a destination?
Do you just mean on the side of the road?
Well, no, let's say they just decide to park outside a business or in the industrial.
That should be approved. So they should
Okay.
have a license for that. And usually they work with our department to get that. And Angie or our sanitarians will go out and inspect
How
typically.
does it work with like ice cream vendors? You know, the ones that used to go up and down the neighborhoods?
Yeah, that's a good question. It might be different because it's prepackaged, but that would be a question for one of our expert sanitarians.
Okay.
But you mean the typical ice cream truck that would play the music?
You hear the music.
Yeah,
and
I'm
keep it
sure they have their license of some sort. The logistics, I don't know on
What
prepackaged
did they
ice cream
call those?
specifically.
Good.
up.
Good Humor is one.
Yeah,
It's like-
it's been a while maybe because of COVID, but we used to get that in the neighborhood. You
It
could
just
hear.
came by our house.
Did it?
last
Okay,
weekend.
yeah, so they're still
that's
around.
your neighbor girls, yeah. And
Oh,
she
yeah,
said
kids hear
they
that.
follow them on Facebook,
Yeah.
and they say when they're gonna be in said area.
Okay.
So they update it, yeah.
And,
But like you said, everything's prepackaged, dated, yeah.
and
But like you said, everything's prepackaged, comes directly out
That's
of.
a good question, though. I'll follow up with our
but even then,
sanitarians.
yeah, you would think they'd still need to be inspected somehow.
Or some have.
Or
some
have
type
some
of-
type of license
have
that I just don't
something
know off the
along
top
those
of my
lines,
head.
Yeah,
My understanding, and correct me if I'm wrong, is that wherever the orders to give them the license,
Yeah.
when they show up here, we have to verify the fact that they're licensed and they
Correct.
look good and they're
Right.
functioning within the guidelines that we have for them. But the licensing would happen from the city that they,
where they get their product from.
or
Yeah.
where they're located or apply
Where
for
their
a license
base
to
is.
do it, so,
Yeah,
do it, so.
yeah.
It kind of, we don't have to go through that every time someone shows up, because we refer back to the city of origin on that.
To make sure their license is correct.
Right. Yeah, otherwise you'd have prepackaged butcher shops, you know. around it.
True.
Beef jerky.
Let's not throw any ideas out
Yeah.
there.
Frozen, yeah, steak, yeah.
The only other thing I have in regards to environmental health updates is which you may have seen if you're a member here, is the recent closure of one of the pools at Innovative. One of the grates required the pool to reopen. So the Department of Safety and Professional Services had done their own inspection, unrelated to us, in regards to some renovations, and noted the drain error on there, and then were required by state statute to follow up. So they're working on fixing that, and that pool will be reopening as soon as it's addressed. But that's all I have in regards to that.
Any other business? Any other comments? Hearing none, we need a motion to adjourn.
Motion.
And a second.
I'll second it.
All in favor?